Can you please explain the artistry involved in the specialty of prosthodontics?
There are two areas of artistry and dentistry that I would like to kind of spend a few minutes talking to you about. The first is what we call the composite diagnostic mock-up. When a patient presents with problems in the aesthetic zone, that's the front part of the mouth, we're oftentimes in need of improving or enhancing the aesthetics in that region. So what I'd like to do for the patient is do what we call a dry run, where in fact it gives me and the patient an opportunity to make changes to their smile in a manner of adding filling materials, tooth-colored filling materials to the surfaces of the teeth. I change the shape of the teeth. I might add to the length of the teeth. I may add to the contours of the teeth to make them a little prettier, a little bit more in harmony with the patient's facial form. And when I do this, we then have an opportunity to photograph this against and compare it to the photographs of the patient prior to making these changes. We can then study them together. The patient even can take a mirror, and the patient routinely does take a mirror, and kind of can analyze this three-dimensionally. They can live with it, they can feel the changes, they can experience the changes. Sometimes they even like to bring a significant other to take a look at the picture and really kind of help them make the decision as to whether or not these enhancements are quite along the lines of what they would prefer to see if and when we move forward to the next step to make the actual changes themselves. So this is just a dry run. At the end of the visit, interestingly enough, patients oftentimes say, can I just leave this on overnight maybe? And I'd like to live with it for a day or two. Unfortunately, it's not bonded to the surface of the tooth, so likely it's going to break off. So rather than do that, I just take photos for the patient. Then when they come back for a consultation and we have an opportunity to study it in detail and compare and contrast, we can really come to a focus on how we can make the improvements for that patient. So this is a big part of the artistry of what I do on a regular basis. In addition, we can actually talk about another area where patients oftentimes have a certain image of themselves, and it usually comes from when they're adolescents or their earlier years in life when they like the smile that they had, and unfortunately over the years, this smile has changed quite dramatically due to traumas, due to changes, just severe decay, discoloration of teeth, wearing on the edges of the teeth, and so forth. So they want what they used to have. And oftentimes the best thing for me to be able to do is request from them several photos from that earlier era. In fact, I have one instance where one of my more well-known patients, he needed and he wanted to have a certain look that was not only his smile, but was the smile of his brothers and other family members. And it transcended all the family generations, I should say. And so to be able to reconstruct that form for the patient required a lot of attention to detail and a lot of trial. Of course, the mock-up was a very significant help as well. But the trial was in the form of making the patient temporary restorations that could be easily modified before we ever got to the final restoration. This is truly part of the artistry of dentistry today, and every dentist has to be focused to be able to deliver this kind of an outcome. And the only way they can do it is if they kind of focus on these artistic components that really can make the difference between just an average case and something that is really excellent.